Have you ever wondered if our ancestors knew something about medicine that we've forgotten? In our modern world of high-tech scans and designer drugs, it's easy to dismiss old medical practices as primitive, even barbaric. But what if some of these forgotten treatments were secretly more effective than we give them credit for? What if, in our race for progress, we left behind some genuinely powerful healing wisdom? Today, we're diving deep into the fascinating world of lost medicine, exploring ancient techniques that might just hold the key to some of our most persistent modern health problems. This isn't about ditching your doctor, it's about opening our minds to the possibility that the past has more to teach us than we ever imagined. So let's pull back the curtain on history and rediscover some incredible, forgotten medical secrets. Let's start with one you've probably heard of, maybe even shuddered at: bloodletting. For thousands of years, from ancient Egypt to the 19th century, draining a bit of blood was a go-to treatment for almost everything. The idea was based on the theory of the four humors: blood, phlegm, black bile, and yellow bile. Sickness was seen as an imbalance of these humors, and letting out some blood was thought to restore that balance. To us, it sounds horrifying, right? Just randomly draining blood? But hold on. Recent science has uncovered a surprising connection. Conditions like hemochromatosis, a genetic disorder causing iron overload in the body, are now treated with something called therapeutic phlebotomy. Guess what that is? It's a controlled modern version of bloodletting. By removing blood, doctors reduce the dangerously high iron levels. It makes you wonder, could some of those ancient patients who supposedly benefited from bloodletting have had undiagnosed iron overload? It's a fascinating thought that perhaps the practice wasn't entirely baseless, just misunderstood. Now let's travel to the battlefields of ancient Rome. Roman army surgeons were masters of their craft, and one of their secret weapons wasn't a scalpel or a suture, but something much simpler: maggots. Yes, you heard that right. When a soldier had a festering infected wound, surgeons would sometimes apply live maggots. It sounds disgusting, but the results were often life-saving. These tiny creatures would meticulously clean the wound, eating only the dead and decaying tissue while leaving the healthy flesh completely untouched. This process, called débridement, is crucial for healing. But that's not all. Their secretions also have powerful antibiotic properties that kill harmful bacteria and promote tissue growth. For centuries, this practice was forgotten, dismissed as folk medicine. But during World War I, a surgeon named William Baer rediscovered its effectiveness when he saw soldiers with maggot-infested wounds heal better than those without. Today, maggot debridement therapy is an FDA-approved treatment used in modern hospitals for stubborn, non-healing wounds, especially those resistant to antibiotics. It's a perfect example of an ancient, primitive practice making a comeback because it simply works. Let's talk about something a bit more electric. In the 18th and 19th centuries, a strange new trend swept the medical world: electrotherapy. Doctors would use primitive batteries and electrostatic generators to send mild electric currents through a patient's body. They claimed it could treat everything from paralysis and muscle pain to depression and anxiety. It was a huge craze, with elaborate machines and enthusiastic practitioners. Then, just as quickly as it appeared, it fell out of favor, dismissed as quackery and pseudoscience. But was it? Fast forward to today. What do we use to treat chronic pain? TENS units, which deliver low-voltage electrical currents to the skin. How do we treat severe depression that doesn't respond to medication? Electroconvulsive therapy, or ECT, a highly controlled procedure that uses electricity to induce changes in brain chemistry. We also have deep brain stimulation for Parkinson's and vagus nerve stimulation for epilepsy. It turns out the old-timey doctors were onto something big. Their methods were crude and their understanding was limited, but the fundamental principle, using electricity to influence the body's nervous system, was incredibly sound. They were pioneers, accidentally stumbling upon a field of medicine that is now at the cutting edge of neuroscience. Now let's head into the forest for our next forgotten remedy. For thousands of years, indigenous cultures around the world have used tree bark, specifically willow bark, as a pain reliever and fever reducer. People would chew on the bark or brew it into a tea to ease aches and pains. The Greek physician Hippocrates wrote about its benefits way back in 400 BC. For a long time, mainstream medicine saw this as just a folk tale. But in the 1800s, scientists finally got curious. They isolated the active ingredient in willow bark and named it salicin. After a bit of chemical modification to make it easier on the stomach, they created something called acetyl salicylic acid. Does that name ring a bell? It should. We call it aspirin. One of the most common, effective, and widely used drugs in the entire world came directly from a forgotten ancient herbal remedy that people had been using for millennia. This story is a powerful reminder that nature is the original pharmacy, and many of the plants dismissed as weeds or old wives' tales might be holding the chemical blueprints for the next generation of blockbuster drugs. It makes you look at the plants in your own backyard a little differently, doesn't it? Let's consider the mind. Before Prozac and modern therapy, how did people deal with mental health struggles? One fascinating and controversial practice was the use of psychedelic plants in ceremonial contexts. From the psilocybin mushrooms of Mesoamerica to the ayahuasca brew of the Amazon, ancient cultures used these powerful substances for spiritual insight and psychological healing. Guided by a shaman or healer, individuals would embark on an inner journey to confront their fears, process trauma, and achieve a sense of connection and wholeness. For centuries, Western society viewed these practices as dangerous and taboo. But now, we're in the middle of a psychedelic renaissance. Top universities like Johns Hopkins and Imperial College London are conducting groundbreaking research on psilocybin, the active compound in magic mushrooms. Their findings are stunning. In controlled therapeutic settings, psilocybin is showing incredible promise for treating severe depression, PTSD, and end-of-life anxiety, often with just 1 or 2 sessions. It seems these ancient cultures weren't just getting high, they were practicing a sophisticated form of psychotherapy that modern science is only now beginning to understand and appreciate. It shows a profound wisdom in using altered states of consciousness for deep, lasting healing. Finally, let's talk about a therapy that involves fire and glass cups, cupping. This ancient technique, with roots in traditional Chinese, Egyptian, and Middle Eastern medicine, involves placing heated glass cups on the skin. As the air inside the cup cools, it creates a vacuum that pulls the skin and superficial muscle layer upward. The goal is to stimulate blood flow, relieve muscle tension, and promote healing. You might have seen the telltale circular marks on athletes like Michael Phelps. For a long time, it was dismissed in the West as having no scientific basis, but think about what it's actually doing. The suction is creating a localized inflammation response. There could be a treasure trove of healing potential waiting there, hidden in plain sight, ready to be rediscovered. What do you think? Are there any other forgotten medical practices that you find fascinating? Let me know down in the comments. I'd love to hear your thoughts. Thanks for joining me on this journey through medical history. If you enjoyed this video and want to explore more fascinating what-ifs with me, make sure to hit that like button and subscribe so you don't miss our next adventure. Thanks for watching, and I'll see you in the next one.